You're listening to Girls with Grafts, a burn community podcast created by Phoenix Society for Burn Survivors, a leading nonprofit dedicated to supporting the burn community. In this podcast, we'll talk with burn survivors, share resources to help with supporting and improving burn recovery, and discuss how to prevent burn injuries. Here are your hosts, burn survivors and Phoenix Society's marketing team, Amber Wilcox and Rachel Kudlak.
Hello, everyone, and welcome back to Girls with Grafts. I am Rachel Kudlak. I'm one of the hosts of the show, and today I'm joined by my lovely co-host, Amber Wilcox.
Hi there. Rachel, you're in a new spot today.
I am. So, spoiler alert, we are pre-recording this. This is our season finale of season 7. It's coming out after the holidays, but my office has turned into Santa's workshop. So I am working from a different desk in the meantime.
I hear you. You can't see it, but there's packages that are slowly starting to stack up next to me today. So, well, not just today, but throughout the season. And so this is the package dump room, right? Until things are ready. So
I know we had friends in town, and I was like, no one open up a closet, please, because all the boxes have just, as Amazon drops them off, they just get thrown into the closet until they get wrapped.
Yep. My son too, we have to kind of hide things right in the closet so that he doesn't see them. And last night I'm like stuffing stuff in my husband's like, well, what if somebody opens it? I'm like, I don't know why they would open our closet. And if they do, they're going to get Toy Story invaded. I don't know what to tell you. Well, I'm excited for today's guest. Today's podcast is powered by the supporters who empower the Phoenix Society's World Burn Congress and their work all year long. Organizations like the DC Firefighters Burn Foundation, the Akron Children's Adult and Pediatric Burn Institute, and the Bakersfield Firefighters Burn Foundation play a vital role by helping survivors and families attend Phoenix WBC through travel and financial assistance. Their generosity ensures that more people can experience the connection, support, and community that help us all rise together. So we're very grateful for them and for Phoenix World Burn Congress. And I did see, Rachel, that we're celebrating 50 years at the next Burn Congress, which is very exciting.
Yes, in 2027. I know seems like a far way away, but we're almost in 2026, and then the planning will get started on the next conference already.
I know. I can't even think of 2027 right now because I'm still don't even know what happened to 25.
I know, this year went by so quick. But I'm so excited that this, like I said, is our season finale of season 7. We'll be back in the new year with more episodes. But today we are welcoming on Francisco Padilla, a doctor of physical therapy and the owner of Padilla Physical Therapy and Fitness Incorporated in Wasco, California. In 2012, Francisco survived a severe car accident that left him with burns covering 80% of his body, necessitating 30 surgeries and a 10.5-month hospitalization. His extensive recovery journey inspired him to return to school, ultimately leading to his career as a physical therapist. He is dedicated to helping others regain full function and is passionate about educating people on the benefits of health and wellness. So thank you so much for joining us today.
Thank you for having me. Appreciate it.
Well, we are, wanting to hear a little bit more about the day of your accident as we ask other survivors to do on this show. So will you walk us through that first before we go any further today?
Yes. So in 2012, at that time I was working in the oil fields, and at that time here in the Central Valley in California, oil fields were booming. So it was really busy, working a lot of hours at the time. I was 25 at the time of my accident, so I thought I could make it with 2 to 3 hours of sleep, on a consistent basis. And caught up to me, fell asleep behind the wheel, and driving home one day from work, and car caught fire, hit a power pole, and with me stuck in it, and that's when I was burned. I don't really remember much. The firefighters, I ended up meeting them after, and they told me that I was conscious, that I gave them all my information, that, I did tell them, that I was just in a lot of pain, and I gave them the phone number to my family's home because I was only a mile away from home already when I got in my car accident. So, from that day, And, they kept me in induced coma for a few months. So I just remember waking up in the hospital after that.
Yeah, and I know I mentioned your hospital stay was almost a year long, but what were some of like the hardest moments for you, at least initially, of whether that's physical, emotional, or mental healing? Like, what were some of those hardest parts for you to overcome?
In the beginning for me, it was the hardest part was just like the physical and just the realization of where I was at. Just because when my car accident was September 3rd, 2012, they told me I'd be home by Christmas, but things were just going wrong, infections, and just things weren't healing the way they should, and everything was just going wrong, basically. So I ended up being there till July of 2013. So through my time there, just going from working in a hard labor job, always working hard labor jobs, and going to the gym, to not being able to stand up on my own, to not being able to raise up my arms, to not being able to do anything physically by myself, just having a colostomy bag and not being able to even roll in bed on my own. It was just very difficult, and psychologically and just physically not being able to do it. It was very difficult for me at that time.
What do you wish people that understood about those earlier days, that maybe there's a misunderstanding or misconception about kind of your recovery?
I feel a misconception is that we understand at that moment that things are going to get better. Because at that moment, I didn't know things were going to get better. Even the physical therapists, the nurses, the doctors will tell me, just put in the work, you're going to get better, things, you're going to have better days. But when you're going through it, or when I was going through it in that stage, you can't see a year from now. You can't see 6 months from now. You just live in the day, and in that day you're in agony and you can't do things on your own. And it just is very difficult. And I feel like that's a misconception of a lot of like health providers, family members, and they just think that, okay, you're going to get better, and you need to understand that you're going to get better. And at that moment, I feel just listening to me, and maybe just kind of just, comforting me, instead of, just like things will get better. It's very difficult to say, just because at that moment, like, you don't see it. Like, I didn't see a year from now. I didn't see myself where I'm at now. Like, if you would have told me, thought, you're crazy. Like, I'm never going to be a physical therapist. I'm never going to go back to college. I'm never going to be in the position I'm in today. I'm be able to run and be able to exercise and do stuff like that. Because at that moment, not being able to even get out of bed on my own, it was very difficult. And I feel the misconception is that, we could understand, but we don't. So a lot of the time, it just, at that moment, it would just been better just to kind of like, just let me speak, let me show my emotions, let me cry, let me, show my pain and stuff like that, and just be there for me.
Mm-hmm. Yeah, and I know that's why a lot of times, we recommend, especially for early survivors, to journal, whether that's writing or taking photos or whatever it may be, because, kind of what you're talking about, like, you necessarily can't see, a week from now, let alone a year from now. But when you can look back and maybe see, oh, last week I could only walk down to the doorway, and now this week I'm walking a lap around the unit, or like little things like that can really help if someone or you yourself are really struggling with, like you said. I totally get it. It's hard to see past the next hour, let alone the next day.
Yeah, that's really good.
Yeah. Well, I know I read again in your bio that you're a physical therapist now, but talk a little bit of how physical therapy, how that impacted your healing journey. And I think there was maybe a physical therapist that you were really connected with. So just tell our listeners a little bit more about that.
Yeah, when I was in the hospital, it was very difficult. It was probably like an hour and a half away from home too. So my family always had to commute or stay the night over there in Fresno. And one of the physical therapists, his name was Ace, and then the physical therapist assistant, his name was Robert. And they would both go in there and they'll joke around with me, and they would kind of like motivate me. And they knew my interests. They knew I liked boxing. They knew I liked, the Raiders. They knew I was a Raider fan. So they would always go in there, with, stories about things that were going on in boxing or with football. And, we built a good relationship. And Robert was actually a burn survivor also, and he turned physical therapist assistant. So he told me his story, and I felt like when I started meeting other like burn survivors that already were past, the stages where I was in, I feel like you listen to them more, like you believe them more, just because they actually went through it also. They're not just a professional; they're a professional and a burn survivor. So, that really impacted me. So, Robert and Ace, we built a great relationship. They were really close with my family, with me. To this day, we still talk. And, he started telling me, Francisco, I think you should go back to school, because they knew my past also. And they knew I was like a high school dropout. And I've always only worked in hard labor jobs. And, I go back to school, you're a smart kid. And I'm like, no, I've never been to college. I don't think I could do it. I just got my GED. So he's the one that really encouraged me and really pushed me, and even like followed up with me after I got out of the hospital. Like, are you going back to school? Are you going back to school, Francisco? Are you going to go pursue physical therapy? And I'm like, no, I don't think so. I'm just going to go get my Class A license, become a crane operator, because I got my Class A, my crane operator cert after my hospitalization, just because I'm like, no, school's not for me. And he just kept pushing me to do it. And after I went and did long haul and then operated a crane for a water pump company too, I'm just like, I can't do this long term. And I ended up going back to school. And he just helped also just with the, paving the way for me, like letting me know what I had to do, knowing that I had to pursue a bachelor degree. And because I'm a first generation college student too. So nobody close to me or in my circle had went to college. And so they really helped me out. The nurses there, the physical therapists there, like we still talk to this day, and they helped me out a lot throughout the way.
I remember my physical therapist very, very vividly, and like still know their names. They still like if I come and visit. And we had quite the love-hate relationship. Like I hated them in the moment, but in like a way that I knew they were just being difficult on me. And to this day, like they still have that very like love-hate joking relationship with them, right? Like we like to mess around. And I remember like they were just very tough on me. And as much as I like didn't like it, if I like didn't have them, I wouldn't be able to like do what I can still do today. And I know that. Do you like, how do you go through that with your patients? Right. Because I know like specifically one of mine was just like, she did the tough love, and I appreciate that. But sometimes that's really hard. I feel like also still just being a survivor, right? Like, I feel like you understand where they're coming from, but also understand that it's probably really difficult. How do you overcome that?
For myself, since I'm the treating physical therapist here at my clinic too, I start off with introducing myself to my patients and letting them know what I've went through, what I've overcome, where I'm at now. Because from when they look at me physically, they look at me and probably think that, this guy doesn't understand what I'm going through. He doesn't understand the pain. And one thing I've realized with working with so many different backgrounds is that it doesn't matter if they're dealing with chronic back pain or new fractures or knee replacements, back, surgeries. They think that they're on their own with feeling high levels of pain. And, I just explained to them that they're in the most difficult stages now, and that things will get better. And I'm a living testimony of that. And I explained to them what physical therapy is, why we do what we do, and my goals for them. And then I'll also just let them, open up about what their goals are too, just so, we could both hear about, each other too. And I try to ask them about their background, what they do for a living, other things that they've overcome, in life. So, we're able to build that relationship early on during the evaluation before we even start into treatment. And I feel that good rapport in the beginning really builds the relationship, and our return rate is really high, I think, because of that.
No, that relationship building is so important. I know for me, it was my occupational therapist that I had growing up, that she was so close to me and my family, and just really became a family member, honestly, with how much time you're spending with them and, the ups and downs. But, I know you talked a little bit too about, like, obviously your journey going back to school, but did you want to become a physical therapist solely because of those relationships that you built during your own healing journey?
Yes, my physical therapist, Ace and Robert, like the impact they had in my life, just not being able to stand, not being able to walk, not being able to raise up my arms over my head, not being able to, do these simple tasks, simple now, but difficult tasks, when I was in that, in that position, it really changed my life. It really made an impact in my life. And it really, made me realize that, it feels great to be able to help others, because I could see how passionate they were about it. And, them still to this day, like, are you still doing this? Are you still doing that? Or, we have mutual patients now. They'll send me, when they have people that come from the Central Valley. So yeah, that really motivated me to go back to school, to become a physical therapist, to be able to help others, to be able to help burn survivors, to be able to help others that are just dealing from, multiple different injuries. And, especially when I work with burn survivors, sometimes I'll work with them pro bono if we don't accept their insurance here and stuff like that, just because I'm really passionate about it. I feel physical therapists, not just physical therapists, but, everybody, what you guys do, healthcare system and stuff, it really could make a huge impact, because, coming from people that have been through similar situations, and I remember the impact that Robert had on me when he told me his story. I'm like, me being a burn survivor and a physical therapist, I feel, I could do the same for someone else.
Yeah, no, I love that. So obviously you went on to become, well, actually, I'm curious, what were some of the toughest parts of school? I originally, when I went to college, I was in a PT program and I absolutely hated it. I thought I cared about the human body. And then I was in, like, all the pre-req classes you have to take. And I just was surprised with the little interest I actually had on it. So
at least she's honest, right? There.
Yeah, ended up switching. But I'm just curious, obviously, after an injury, you already have so much on your plate, and then you added on going back to school, and not just, for your bachelor's, but to get your doctorate. So what was going back to school like for you?
It was really difficult. It was like one of the most difficult things I went through, other than the burns, probably, just because I dropped out of high school maybe like my sophomore, junior year. And so my education was like very low, like, and so reading and grasping information from the books, it was very difficult for me. So I was getting tutors. I was, just watching YouTube videos. My days for, like, my whole school, it was basically like 12 to 13 hours studying a day, and it was just, I had no life at the moment, for a long time. So, that was very difficult. And then, yeah, you are correct with the prereqs. I feel like that's very discouraging, because you have to take all these classes to get you to the point to actually learn about what catches your interest.
Yep.
And I feel, if we could eliminate all that, the education system wouldn't be, well, not education system, but the physical therapy route, occupational therapy route, nursing route, if we could get rid of history and math and, all these gen ed classes.
Physics. Physics was the worst.
Physics 1A, physics 2B, chemistry, Chem 1A, Chem 2B. Like, we had to take all those classes just to get into this program. And it was very discouraging at times. And to the point where it's like, if I can't pass chemistry, why can't I now get into a doctorate program for physical therapy? Mm-hmm. And I'm like, I'm passionate about the human anatomy and learning about the body, but, molecules don't really, catch my interest. So it was discouraging for a long time, but it was just, I would just, tell myself, it's part of the process, and, that's why a lot of people don't do it. And, I just got to stay with it. And, obviously just kind of going, MIA from everybody, just showing up to just family get-togethers and kind of not having friends and stuff like that for a long time. really helps to stay focused.
Yeah, you definitely have to give up some of your social life while you're in your PT program. That's for sure. But no, I just want to give you huge kudos. I mean, the fact, that you went back and went and got your bachelor's and now your doctorate and now you have your own practice is just so amazing. So definitely huge kudos for that. But tell us a little bit about just what like a typical day as an owner of your own practice looks like.
It's nonstop for me. I like to be physically active, obviously maintain my physicality, just because I do work with like a lot of like the high school athletes too, and work with just multiple different backgrounds from 5-year-olds to 90-year-olds. And, I like to be able to be functional for them. So I start off my day just by getting the exercise in before I come to work, and then I open up the clinic at 8. So I have to get here before that just to kind of get everything going. And from the day that we start to 5:30, it's just nonstop. I'm in a small community, a big Hispanic community, so we have a lot of patients that are very happy that we're in the community now, just because they don't have to drive to other cities. And so we are very busy. So on average, I do about 5 to 6 evaluations a day, and we see about 20 patients a day, or plus sometimes, depending. And being the business owner too, we have to worry about all the credentialing, making sure that we're getting paid, making sure that that everything's going smooth, that I'm able to pay my employees, that I'm able to do all these things that come with the business also. So sometimes that does kind of take away from not patient care. I try to really focus on I've been able to incorporate a lot of new tools like scribe systems and stuff like that, so I'm not taking so much time documenting. So documentation now very limited. Like now I document maybe for like 2 minutes per patient. When before I started implementing these systems, it was taking me like 15 to 20 minutes per patient. So, I feel like just still like doing research, still educating myself, looking online to see the latest tools that we're able to implement for the business. Because what I'm most passionate about is taking care of my patients, like, getting them to full function as quick as possible, and getting them to full range of motion as quick as possible, to educate them as much as possible. And it was limited before when I had to take so much time doing other things. But now that I have a good team, it really helps me treat my patients, where I'm able to spend time with them and actually do the things we need to do to be able to get them better, at a faster rate.
I have questions in terms of modalities. So when my physical therapist, after the hospital, I should say, it was during COVID. So my physical therapist was great. And we did some sessions first that were virtual over Zoom, which was fantastic, like having stretches and things like that when I couldn't meet in person. But when I was finally able to meet in person, they were great. I had a massage therapist that helped me, and then like that was in the office, and then we did like stretching and stuff. So what do you do like initially, right? I'm sure when the scars are still like healing, there's not a lot that you can do, but once they're healed, what are some of the things that you do with some of your patients?
I do a lot of like contract release techniques. I kind of got rid of like the old model of like majority of physical therapy clinics where you go in and they put like a hot pack or cold pack or TENS units and stuff like that. Kind of eliminated all that. We don't use none of that here. A lot of it is more functional movement and like deep stretching, deep exercises. And when there's like a lot of scar tissue, like I'm working with a kid right now, he's a burn survivor, and he has a lot of scar tissue around like the wrist. So he's very limited. So what I usually do, I'll apply pressure at a certain area of the scar. I don't go to end range because that's going to just cause him a lot of pain. So I'll usually kind of just go to a certain point where I'm able to apply pressure and stretch it from there while I'm like pinning down the scar tissue. So I'm able to stretch it a little bit by little bit, just so I'm not going to his end range where it's causing him a lot of pain, because he's small, so he like cries a lot and stuff. So I don't, not to cause him so much pain, I try to just do pin and release. And there's other techniques also. They're called like contract and release. So where I'll have him like contract their muscle and then relax it, and it kind of is called like the agonist and the antagonist. So when you're doing that, you're able to get the muscle released a little bit more. So we're able to stretch at end range the scars. So the muscle is not the limiting factor. We're actually able to work all the way into the scar, because when we do have a lot of scar tissue, also a lot of the time it's the scar that's limiting it, but then also the muscle gets shorter too. So we have to be able to, see which one it actually is. If it is just the scar or is it the muscle also. So I do a lot of hands-on therapy for my patients, try to,
That's awesome.
Mm-hmm.
Do you have, so I feel like we get this question a lot, or at least when I went to support, there were a lot of folks that were several years post or injury that were still experiencing pain, or maybe they didn't get physical therapy at the time offered to them, that were getting pain that felt like they needed to see someone else. Like, do you ever experience it where you have survivors that maybe are still experiencing issues several years after their injury and then decide to come in and say like, hey, what stretches or things can I do? Like, are those types of patients that you could also see? Maybe they weren't offered physical therapy at the time of their injury. Like, do you have those types of offerings that you could provide?
Yes, there's actually we take like, even when I was in school, we learned about like pain, because pain is from multiple different aspects, right? And it works multiple different ways. So when someone comes in with pain, but everything is fine functionally already, I try to educate them on pain, on how it works, and I use examples such as like phantom pain. Why is someone going to have pain if their extremity is not there? It's more in the brain, right? And I don't try to tell them. And one thing that I always tell them is that your pain is real, because some providers will be like, oh, your pain is not real. And I've dealt with that myself. But what I try to tell them, everyone's pain is real. What you're feeling is real. But what we need to do, we need to be able to address that. So the example I use is like phantom pain. So if someone doesn't have an extremity anymore, like for my hands, like in the beginning when I lost the digits to my hand, like I would still feel them. I would still have discomfort at the ends, right? And even though they weren't there. So I would tell them, the pain is there because psychologically, your brain is telling you that it's there. But physically, there's nothing there anymore. Everything is, if you're healed already, everything is healed functionally. So just knowing that it's the brain aspect of it that is telling you that you have pain, they're able to come to the realization that we need more than, stretching and, physical activity to decrease that pain. We need psychological help sometimes too, not like seeing a psychologist, but like some type of therapy, some type of, deep breathing. I'll teach them diaphragmatic breathing, pursed lip breathing, trying to relax the body, TENS units too, just put a TENS unit on there, because a TENS unit, like the way I explain to them, the way a TENS unit works sometimes also is that, if you hit your funny bone, it hurts, right? The first thing that we do is rub it. Why does rubbing it work? The rubbing it works because we're distracting the pain point by the rubbing sensation. So since we're able to distract it, that pain decreases right away. So if I'm able to explain to them the way the pain works, they have a better understanding, and they're able to use these tools at home too. And sometimes I'll send them home with like some, education on like how to do pursed lip breathing, or how to do diaphragmatic breathing, on just how to relax their overall system, just to relax your body.
I will say a lot of folks used to tell me that my experience with, so I'm a yoga teacher, and before my injury, I did so much yoga, right? And then a lot of folks said that like my pain tolerance was what it was because of the skills that I had in yoga and the breathing that you learn in yoga. Like, you learn to breathe through things, and it is remarkable to like understand that breathing techniques do work, and they do help you through like painful situations. And my husband I always said, like, I think it was my yoga experience that really helped me learn how to, like, when you're in pain, be able to breathe through it, because sometimes I feel like you forget to breathe when you're in pain, and that causes you to just be that much more like heightened. So that is very interesting to hear you say, like, you give them like pain techniques. I think are a big part of it, right?
Yes, 100%. Yeah, no, that's great that you're a yoga instructor. And I always tell them, watch yoga, on YouTube, go to an instructor if you have the ability to do it, because I feel it's very good to kind of like learn your body and learn how to relax, because a lot of my patients do that, even that when they come in for like rotator cuff tears or replacement, knee replacement stuff, the ones that get very tense, I've noticed that the response to recovery is very slow versus the ones that relax their bodies, and I'm able to actually take them to full range. Their recovery's like from night and day difference. Like they recover within a few weeks.
My husband, I tell this story a lot, and my husband and I was in avid yoga, like hot yoga. So I wasn't just like some little like I was into hot yoga, sweating it out before my injury. And after my injury, I just kept thinking I'm never going to be the same person again. Right. Like that's not going to be me. I'm not gonna be able to go to hot yoga. Spoiler, I have gone to hot yoga since. But I will say I just kept thinking like, I will never be that person again that could do all those things. And I wanted to prove myself wrong. But in the moment, I remember thinking like, I'm never going to be that person again. And I'll never forget the greatest thing my husband ever did for me was, I mean, he's done a lot of great things, but he sat me in front of a chair, sat me on a chair in front of the TV, put on YouTube and literally put a chair yoga class on. And I was like, this is stupid. Like I am so much better than this. Or I was so much better than this. Like, why do I have to sit in front of this television and do this stupid, what I thought at the time, stupid chair yoga class? Like, this isn't going to do anything for me. And I'll never forget. I said this, I continue to repeat this. It was silly. I couldn't walk right at the time, or I couldn't really use my legs, but they had you lift your arms over your head. And I had been sedentary for so long from my injury that both of my sides had really contracted. And I felt like I didn't feel like myself anymore. And then I did that for the first time. And I remember sitting in my chair, after that 20-minute yoga class where I just sat there, right, and did that, and feeling like a different person and feeling more like, okay, if I can do this, maybe I'll try to do something a little bit different tomorrow. And my husband ignited this thing in me that was okay, if I can do this small thing today, what can I do tomorrow? Or what can I do? And so then it was okay, put my yoga mat out for me, make me, he lowered me down onto my, okay, I'm going to do floor yoga today. And so there are so many different types of yoga where you don't have to be in a class jumping up and down or doing all these crazy things to be able to feel like you're doing some sort of yoga. And the stretching and the progression of what I did is really what helped me recover. Physical therapy was starting it, but then my husband was also empowering me through this yoga practice that really ended up okay, little steps at a time made me this person that was okay, I think sometimes we don't realize that we can do more than we can. And my physical therapist during that time were the same thing, right? My physical therapist would be you can walk up the stairs. And I'd be but I can't. Right. And so I think sometimes fear gets the best of us too. And it's because of folks that we need to put our trust in that tell us okay, no, these are the things you're allowed to do. But during that time, I remember thinking if it weren't for that yoga class, I probably wouldn't have made it out, because I would be still not doing things that I'd still be nervous about, I don't want to stretch this way or do this. And so it's definitely progressed much better today. And I think that that little moment for my husband to really get me back here.
No, that's awesome. Yeah, that's really awesome.
Yeah. And I'm curious too, especially Amber, you just shared, obviously your husband was a huge supporter and kind of pushing you a little bit further. But Francisco, do you have any advice or tips, especially for loved ones, maybe their parent, a partner, a spouse, who, want to help the survivor in their life continue to push themselves and to get better? Or I guess I'm just curious if you have any tips for them.
Yeah, I feel just kind of knowing what your significant other is or your family member is at that moment. For me, I've always been I've always responded better to kind of tougher love, just because my relationships with my brother, my sister, my cousins, I always grew up being kind of tough. So, knowing how to talk to the person you're talking to, right? Because if you talk to somebody rough that doesn't respond well to it, you're going to shut them down. And if you talk super gentle to someone that needs tough love, you're not going to motivate them. And for myself, what I realized at that moment, like my brother, he like showed me a lot of tough love. He would like talk trash to me. He would like tell me, you're gonna, just be in that bed the rest of your life if you don't get up. And what do you want? You want us to take care of you forever? You want to do this? And like he would talk to me like kind of rough, and I would get mad at him at the moment. But because I would get mad, like I would do the stuff. Like I would do the stuff that the physical therapist told me to do when they weren't there. Because they would always give me homework, and they would tell my family members, make sure he does it, make sure he does it. And you get very unmotivated, especially when you're in a lot of pain and you've been there, and you're just like, no, I'm not going to do it. I'll wait until tomorrow or when physical therapy comes again. And so I feel like just knowing who you have in front of you, right? Like I know for my wife, she's like more gentle, like, so I'm not going to use tough love for her because, if something like that happened to her, showing tough love to her is going to just shut her down, and she's not going to be motivated to want to do anything. But if I, am more gentle and I tell her, you got this in you, look at what you've been through before, like do it for our daughter, like kind of use encouraging things, something that's going to kind of, make them want to fight for another day to kind of do a little bit better. I feel, that would motivate her a lot more than me talking trash to her and telling her, you're going to be like this your whole life, So I feel everyone responds different. So knowing the person that you're talking to and knowing that their personality traits are different than yours, just because I'm like that doesn't mean that she's going to respond to the way I responded to. So I feel like that's huge, really kind of figuring out who you're talking to before you start trying to motivate them, because you could be having a negative impact too.
For sure. And I know, you talked earlier about, building that rapport and that relationship with your patients. And I'm sure you do a lot of that too, of like, what is motivating to them? What kind of, what kind of tough love or gentle love do they need from you?
Yeah, 100%.
Yeah. Well, and I'm curious too. I know obviously you see more patients than just burn survivors. So like, how do you handle patients who have more of that like emotional trauma along with their injury versus someone who maybe, I don't know, maybe a less emotional trauma filled injury? How do you kind of balance between those two?
I feel like with all my life experience, just not with burns, but just with my past and things I've been through, I feel like I'm able to relate to a lot of people. And I've had, females in here that come in here and their husbands passed away and they're very depressed, and and it's been pretty like common to where I have like a good amount of them, or something else happened in their life, or they've been through something. And one thing I've realized, I just like listen. I just listen to them, and let them know that they need this right now, that they need to be physically active, that they need to get out of their home, they need to kind of interact with family members, and I feel like that's helped out a lot. Just having a lot of experience with multiple things in life, I'm able to just listen, because some people just need you to listen. Some people don't really need education. Some people don't really need you to tell them what to do. They already know what to do. It's just hard for them to do it. So I always just encourage them, show up. You're happier when you're here, and you tell me yourself that when you come here, you feel like you're at home with, and you're able to talk to people, and you're able to, actually communicate, and you're not just in your room, locked in your room watching a show or something like that. Here you communicate with people. So, I just tell them, show up, come straight for a good 2 to 3 weeks, and, give it a shot. What's the worst that could happen? And I feel like, that's kind of really been the big cue, like, just kind of listening to my patients, figuring out what their pains are. I had a young patient too, actually went to school with her, and she started telling me about the pains and the numbness and tingling she started having when, like, about a year ago. And I started asking her, was there any traumas around that time? And she told me, oh, I never had that correlation. Nobody ever asked me that. But yes, my father passed away like a month before I started having my pains, and physically there's nothing there. MRI, X-rays, everything's are done. Like there's nothing there, but she still is hurting from the loss of her dad. And that's because I guess they had a really close relationship. And so I always, listen to them. I ask them personal questions. It's not just I try to build those bonds with my patients. It's not just, I'm going to get you moving. I'm going to get you exercise. I'm going to stretch you out. No, it's nothing like that. I really try to build in that relationship with them. And I feel like that's been the biggest part of, being very, my patients doing very well with me. My patients actually, we get a lot of good results here.
That's amazing. Well, I know we are coming up on our time and we do have 2 final questions, but I do want to quickly ask you 2 more before we get to those 2. I want you to share how our listeners can keep in touch with you. I know I follow you on Instagram now, but I want you to share some of that info. And I'm also just curious, what is your favorite part of your job?
You can follow me on, I have Padilla Physical Therapy. Also, that's just like my business page, and then my personal page is Francisco Padilla PT. But my favorite part of my job is communicating with others and changing lives. Like, it seems so simple and cliche, but it's true. Like, you really change lives. I've had multiple patients come in and tell me that they're getting. I remember one patient was 61 years old, never stepped inside of a gym or anything like that. And after coming to physical therapy, he went to go get a gym membership. And it was like, and it's older Hispanic male that, is not really common in our like culture and stuff like that too. And he's like, I'm going to get a gym membership, because you really motivated me to do more. And to the patient where like they need back surgery and they come in here because they have like numbness and tingling down to the leg. And now they don't have no radiating pain. They don't have no back pain. And, the surgeon like is telling them, oh, you still need surgery. And the patient's like, why do I need surgery? And I'm like, you don't need surgery. If you don't have any pain no more, you don't have no limitations, let them know that, you have to speak for yourself. You have to let them know what's going on. And that's one of the other things too, like I'm just very passionate about the differences that we make in people's lives.
That's awesome. Yeah, that's definitely, I will say, like, my physical therapist still has a very special place in my heart. And like I said, even if it was tough love, it's the one thing I was so grateful for, because and it's very hard, right? I was offered, I could either have physical therapy or at-home care, and I needed the at-home care. But when I saw that the at-home care wasn't really doing anything for me to move the needle, I switched and was like, we can do this ourselves. I really want the physical therapy. And so physical therapy is such an important thing. And like, I would encourage others that like, if you are questioning whether or not you actually need it, like just go and see someone like Francisco, because it's definitely important. Well, we always ask our listeners 2 final questions. I really appreciate your support today. This has been awesome. What gives you hope, or how do you give hope to another survivor when something might feel heavy or right, like really struggling?
Majority of the time in the beginning, it's the darkest days. It's the hardest time. And like I said earlier on that, in the beginning, you don't see a year from now, but I always say just to set short-term goals, because at the end of the day, like walking more, the next day, trying to, be on your feet maybe like 5 more minutes, and actually tracking it, like journaling it, like Rachel had said earlier, like, because at the end of the day, like when we go through something, that's actually the hardest time. That's the most difficult time. That's the darkest time. So if you come to the realization that that's the hardest time you're in right now, that the light is going to get brighter and things are going to get better. Because when I was in my darkest time, I didn't see it either. But day by day, things got better, and I would have never thought I would be in the position I'm in. But look at me, I'm doing very well, and I'm able to help other survivors and other, patients because of the hard times, because the hard times made me who I am today.
That's awesome.
That is awesome.
Well, it is time for our final question, and that is, what do you hope someone listening to your story feels or learns today?
That anything's possible. I really, tell people it was a painful blessing, and sometimes we don't realize that because of the things that we're going through or the difficult times, but I feel like I'm just a living testimony of that. Anything is possible, that if you really give it your all, if you just go at it something 50%, you achieving your goals is very unlikely. But if you dedicate yourself to something and you go at it 100%, you could achieve anything you can, because I never thought I'd be educated. I never thought I'd go to college, but pursuing this career made me realize that anything is possible. And now, just because I was able to achieve my doctorate degree, and I never thought I'd even go to college, I'm like, you know what, I could start a business too. And then I started a business, and then now I really feel like the sky is the limit for anything that I want to achieve. And I always want people to realize that it doesn't matter where you're at, what background you come from. It doesn't matter if you're the first one in college. It doesn't matter if you can't walk, if you can't do anything. You could always do more.
No, that's awesome. I love that. It was a painful blessing. I love that.
Yes.
Awesome. Well, thank you so much, Francisco, for joining us today. It was so great meeting you at Phoenix World Burn Congress, and I appreciate you coming on the podcast today.
Genuinely, it was a pleasure. Thank you so much.
Yeah. Thank you for giving me the ability to share my story and share with you guys everything.
Yeah, and Happy New Year to everyone. I know this isn't going to air until after the new year, but Happy New Year to everyone. Hope you have a great 2026.
You too. Thank you. Bye-bye.
Bye.
Bye.
Thanks so much for tuning in to this episode of Girls with Grafts. If you are enjoying this content, please feel free to rate, subscribe, and leave a review wherever you listen to your podcasts. This helps others find the show, and we greatly appreciate it. Thanks again for listening, and we'll catch you in the next episode.